I would like to begin by giving thanks to our First Nations and acknowledging that in this region we live, work, and assemble on the lands which are, by law, the unceded and unsurrendered territories of the Wabanaki people, predominantly the land of the Mi'kmaq and the Wolastoqey. We recognize and honor their enduring presence, culture, and stewardship of this land. We are committed to fostering respectful relationships and working towards reconciliation. My name is Alicia Mazerolle, and I'm the Associate Director of YWCA Moncton. Aujourd'hui, nous avons avec nous l'honorable Ginette Petitpas-Taylor, Member of Parliament for Moncton-Dieppe, and YWCA Moncton's Chief Executive Officer, Miche Nadeau. Please note that there will be an opportunity for media to ask questions following the announcement. Prenez note que le média aura la possibilité de poser des questions lorsque l'annonce sera terminée. On behalf of YWCA Moncton, we would like to thank everyone for being here today. YWCA Moncton supports women, youth, and families through housing, childcare, employment, and community programs that foster stability and belonging. Our continuum of care means that no matter which door someone walks through, they find connection, compassion, and the right supports to take their next step forward. Nous nous engageons à continuer de servir notre communauté en lui offrant les programmes et les services dont elle a besoin. Today, we are here to talk about the Government of Canada's investments in Atlantic Canada through the Substance Use and Addictions Program and the Emergency Treatment Fund. It is now my honor to introduce the Honourable Ginette Petitpas-Taylor, Member of Parliament from Moncton-Dieppe, who will share more about today's announcement. Thank you.
Thank you so much, Alicia. Good afternoon, everyone. Bonjour tout le monde. À titre de député pour la circonscription de Moncton-Dieppe, c'est toujours un plaisir pour moi d'être ici parmi vous. Puis je suis toujours contente d'être ici chez nous, dans mon coin du pays, spécialement quand on peut faire des annonces très importantes pour une clientèle qui me tient beaucoup à cœur. Also, I would be remiss if I didn't acknowledge that Dominique Leblanc, unfortunately, could not be here today à cause des imprévus. Il n'était pas disponible pour venir se rejoindre aujourd'hui. Mais comme j'ai dit à Michel, je vais absolument faire sûr qu'il va venir pour une visite, pour voir le travail essentiel que vous offrez ici. Aussi, first of all, I also want to take a moment to thank the YWCA for hosting us here today. Michelle and the team, thank you so much for opening your doors. Just a few weeks ago, we were on a bus trip together going to the 25th anniversary of the World March for Women, and we had a great time. The Y has been involved in helping women for centuries now, and again, the work continues in our community, and we are very fortunate to have you. And I see year after year the work expanding. So Michelle, to you and the team, hats off, and very well done. They deserve a round of applause. You all deserve a round of applause. Mes amis, nous reconnaissons qu'aucune communauté n'a été épargnée par la crise des opioïdes qui sévit dans nos rues depuis les dernières années. Ces effets tragiques sont visibles et ressentis chez nous et chez nos amis, nos familles ainsi que nos voisins. That's why that we need to provide wraparound care to people who use substances, one that is woven through every area of their lives. Prevention, treatment, harm reduction measures all have a role to play. We don't have one single solution. I think we have to really look at the holistic approach. As a part of this comprehensive approach, Canada's government is supporting community-based projects led by amazing organizations like the YWCA that is hosting us here today. I know that many of you here today are working tirelessly to support people who live with a range of issues related to substance use. And I want to take a moment to thank each and every one of you. I want you to know that your government stands by you and is certainly there to support you during this work that you're carrying out. And I personally want you to know that you have an ally in me, and if ever that I can be of any help or assistance, please don't ever hesitate to reach out. Being a social worker, you're always a social worker at heart. It doesn't matter what your profession is afterwards. Nous vous remercions encore une fois pour tout le beau travail, car vous apportez une contribution importante pour nos communautés, vos communautés. We thank you because indeed the overdose crisis continues to be having devastating impacts across our country, and the southeastern New Brunswick is no exception. This crisis is certainly widespread, and we recognize it is one of the most serious public health challenges that we are faced with right now as a country. Il s'agit d'une crise qui nous touche tous profondément et qui a un impact important sur notre communauté. To this end, the Substance Use and Addictions Program, or also known as the SUAP program, is a part of the federal government's efforts to help local communities respond to emerging critical needs related to the overdose crisis. Today, I'm extremely pleased to announce, on behalf of my friend and colleague, l'Honorable Marjorie Joly, the Minister of Health, an $8 million contribution to support 9 organizations across Atlantic Canada through the Substance Use and Addictions Program. Aujourd'hui, j'ai le plaisir d'annoncer, au nom de l'Honorable Marjorie Joly, la ministre de la Santé, que 9 organismes communautaires de la région du Canada Atlantique vont recevoir un financement d'à peu près 8 millions de dollars dans le cadre du programme de lutte contre la toxicomanie et la dépendance du gouvernement du Canada. Today, the funding supports a range of projects, including 9 in total across Atlantic Canada and 2 based here in Moncton. Initiatives that are designed to improve health outcomes for people who are at risk of experiencing substance-related harms and overdose by scaling up prevention, harm reduction, and treatment efforts. This funding will allow community-based organizations to use their experiences and their expertise to meet the unique needs of people struggling with addictions in their communities. Les organismes communautaires et les gens qui travaillent apportent un soutien très important aux gens aux prises avec des dépendances. Ils sont un maillon essentiel de notre filet de sécurité sociale. I'd like to take a few moments just to talk about the 2 projects that are based here in Moncton that will be receiving funding just for a few moments. So first, the YWCA Pathways program will be receiving more than $540,000 for its project aiming to help women and gender-diverse individuals succeed in maintaining long-term sobriety. Tout d'abord, le programme Pathways du YWCA recevra plus de $540 000 pour son projet visant à aider les femmes et les personnes de genres divers à rester sobres à long terme. This initiative will provide post-treatment care, supporting individualized recovery plans, as well as peer-led groups, networking, and adaptive wraparound services and supports within the Greater Moncton area and also the surrounding areas. The second organization that's receiving funding from Moncton today is Ensemble, and we're really happy to have someone from Ensemble with us today. So Scott, thank you for being with us. Really appreciate it. I have to say as well, a little side note, last week some staff from Ensemble came to my writing office in Moncton and provided us with naloxone treatment. So we wanted our office is on St. George Street. Mind you, everyone should have naloxone treatment, I feel. And Ensemble just provided a great training to us. So thank you to you and the staff for putting that on for us. It was well appreciated. So the organization Ensemble is receiving more than $520,000 for its project HOPE. And HOPE stands for Helping Overlooked Persons Excel. Deuxièmement, l'organisation Ensemble reçoit plus de $520 000 pour son projet HOPE, qui vise à aider les personnes négligées à s'épanouir. HOPE will provide workshops, information sessions, and group activities to people with lived and living experience of substance use in the Moncton area. These education sessions are focused on increasing knowledge, harm reduction practices, and self-advocacy. Through this initiative, Ensemble will also be providing all participants with access to on-site counseling and a nurse practitioner for health assessments. And again, when we talk about addictions, we have to treat it as a health issue and not a criminal one. And I just think it's fantastic that people will have access to a nurse practitioner. Ce travail consiste à sauver des vies et nous devons utiliser tous les outils à notre disposition pour aider les personnes qui sont en besoin. Like you, the Government of Canada believes in providing a full range of supports and services to people who are at risk of substance-related harms and overdoses. Tout comme vous, le gouvernement du Canada croit qu'il est important d'offrir une gamme complète de mesures de soutien et de services pour les personnes qui courent un risque de subir des effets nocifs liés à la consommation de substances et de surdose. There is no one-size-fits-all, and I think everyone in this room certainly knows that, in solving the overdose crisis. We truly need to have all hands on deck in using all of the measures that we have at our disposal. And that's why the Government of Canada, your government, is working with all levels of government, stakeholders and Indigenous partners, and community groups to address the unique challenges people need. Once again, I want to take a moment to thank everyone that is working in this field. Thank you for your compassion. Thank you for your dedication to our community. And just in closing, I know that the work that you do on a daily basis is not always easy, but just know that you're saving lives. Vous sauvez des vies. Encore une fois, merci beaucoup du fond du cœur. Et maintenant, je passe la parole à Michel. Merci beaucoup.
I feel these mics have been up and down. Ginette, thank you so much. It's always such a privilege to have the chance to interact with you. Welcome home. I hope that you feel that YWCA Moncton is your home. We feel like you're part of a family, so thank you for being here. And yes, we've been wanting to host and welcome MP Dominique Leblanc, but still not today. But we remain hopeful, so hopefully one day we'll have the chance to welcome him in-house as well. Good afternoon, everyone. Bonjour et merci d'être ici. On behalf of the YWCA Moncton Board of Director and team, I want to begin by extending a heartfelt welcome and sincere thanks to Health Canada and the Government of Canada for their leadership and investment through the Substance Use and Addictions Program. Votre engagement à lutter contre la consommation de substances et à soutenir le rétablissement sauve des vies et aujourd'hui, il renforce l'avenir de notre communauté. I also want to acknowledge and thank the many partners, colleagues, and community members who have joined us, especially those with lived and living experiences of substance use and recovery. Your voices, your courage, and expertise have shaped this project from the very beginning. For those who may not know us, YWCA Moncton has been part of this region for more than a century, empowering women, girls, gender diverse individuals, and families through advocacy, education, and wraparound services. From supportive housing and childcare to youth and wellness and employment programs, we work every day to ensure that our community members have access to safety, stability, and opportunity. Comme de nombreuses communautés à travers le Canada, Moncton fait face à une crise persistante et déchirante liée à la consommation de substances. We have learned that overdoses are at a record level, and first responders receive more than 10 calls a day. Behind every one of those calls is a person, a mother, daughter, friend, or neighbor trying to survive, to recover, to rebuild. In recent months, local media has shone a light on what we see every day, a community struggling under the weight of an opioid crisis and women navigating systems that were never designed for them. Women and gender-diverse individuals experience addiction and recovery differently. They often face stigma for seeking help, fear losing custody of their children, and carry the weight of trauma and shame. They also carry the incredible strength, resilience, and determination. Let's not forget that. That is where the YWCA Moncton Pathways program comes in. I have my teammates here. Through this 4-year, more than $540,000 are going to be invested from Health Canada in Pathways to support more than 175 women and gender diverse individuals from across the Greater Moncton area as they move from treatment to recovery and beyond. Pathways was designed and will be led by people who lived and living experience, ensuring that empathy, understanding are woven into every step. Participants will join 8-week cohorts where they will explore topics and contribute to wellness and long-term recovery, such as healing from trauma and grief, building healthy relationships, financial literacy, parenting, and discovering who they are beyond substance use. To remove barriers, participants will have access to childminding, transportation, and healthy food. These supports, simple as they may seem, can be a big difference between giving up and showing up. Et parce que le rétablissement ne se termine pas à la fin d'un programme, Pathways créera également un réseau de soutien par les pairs, une communauté où les participants pourront rester en contact, partager leur parcours et inspirer d'autres personnes qui empruntent le même chemin. We are proud to collaborate partners including Salvis Clinic, Addictions and Mental Health Services, Ensemble, who's here, thank you for being here, Moncton Detox, and others. Together, we're creating a continuum of care that bridges treatment, aftercare, and community wellness. Ultimately, Pathways is about more than a program delivery. It's about changing systems and ensuring that every woman and gender diverse individual has access to support that reflect their lived experiences and realities. Grâce à cet investissement, nous aurons non seulement un impact local, mais nous recueillons et partagerons également des meilleures pratiques au sein du réseau YWCA, créant ainsi une façon de contribuer à l'éclaircissement des programmes de rétablissement à travers le pays. On behalf of everyone at YWCA Moncton, thank you again to Health Canada, to our partners, and most importantly to those with lived experiences or living experiences, whose insight and courage have made this possible. When women and gender diverse individuals have the right supports, they do not just recover. They rebuild their lives, their families, and our collective future. Thank you. Merci beaucoup. And now Greg is going to close this afternoon. Thank you.
Mark, over to you.
Thank you. If you are a reporter and wish to ask a question, use the hand-raising function. Please limit yourself to one question and one follow-up. Si vous êtes journaliste et vous désirez poser une question, vous utilisez l'option de lever la main. Merci de vous limiter à une question et un suivi. Just give me a few moments. Okay, we have no questions on the Zoom, so that will conclude today's event. Thank you very much. Ceci conclut l'événement d'aujourd'hui. Merci et bonne journée.